decades of work, Diane Kovich has been caring for patients for more than 20 years, and some of the very patients she's cared for, she now works with. We share her journey of inspiration. Good morning. I'm Jessica Lovell in for Alexis Del Cid this morning, and welcome back to All Things Heart. Diane Kovich has inspired so many patients in her decades of work. She has made phone calls to teenagers who aren't keeping up with their medical needs. She's watched her patients grow up, and now some of those very same patients are her colleagues.
Hey, how are you?
We wanted to ask Diane Kovich, who became a nurse at age 21, if she ever dreamed she'd still be working as a nurse at age 73.
Did you ever think?
No.
Clearly, she's been asked this before. And 52 years later, while she's cut back on her hours a bit, she's still happily seeing patients because, simply put, the idea of not working gives her FOMO.
There's always something new to learn. It's like, what am I going to miss out on if I don't work?
For the first few decades of her career, Diane was an RN at a different hospital. But when the University of Kansas Health System reached out to her about joining the Adult Congenital Heart Disease Clinic, she jumped at the chance.
It was so different than anything we'd done before. And you became like a mother to a lot of these kiddos.
Many of her patients are no longer kiddos, but they know the stress of once being a kid who had to transition to adult care and how comforting it was knowing Diane would be their RN.
She's somewhat of an institution here, and so it's just great to have somebody who gives the care that she does.
She is loved by all patients.
Which brings us to two other patients of Diane's.
I was born with a heart condition called tetralogy of Fallot.
I had open heart surgery when I was a baby.
Who are all grown up and also happen to be her coworkers now.
I first started coming here when I was 21, and now I'm 32.
Brooke Horvath is a medical assistant.
I wanted to help people the way that I was helped, and Diane's just a huge inspiration.
Elena Wade is a cardiac sonographer.
She's just an expert on so many things. She has the expertise because she has been here for so long. She has the connection with the patients, and that is amazing because not everybody has that.
She's just really personable and really caring, and it shows through her work of how she treats each patient.
But when we ask Diane if she's aware of the profound influence she's had over her patients,
I guess I never thought about it.
it makes sense why she doesn't think of her legacy. Diane is focused on the present, the career she loves, and the patients right in front of her.
Thank you, Todd, for doing
Always
this.
a pleasure to see you.
You too. I just always have enjoyed learning, and there's always something new to learn in medicine, always.
We are so glad to have Diane in studio with us today. Can I say at 73, I'm holding you back here in the studio to get some of your secrets. I've already decided that, okay? So we also are so glad to have Dr. J.D. Surface with us. He is the director of the Adult Congenital Heart Disease Clinic. Dr. Surface, great to have you here with us.
Thank you. Happy to be here.
And we are also joined by one of Diane's patients, Elena Wade. How are you, Elena?
Good morning.
Elena is also a congenital echo sonographer, so we're going to learn a little bit about what that is here in just a bit. But Diane, how does it feel just to know that you've inspired these women, and I'm sure so many others, just to be in the healthcare field?
Well, I don't think it was just me. I think it was all the people that have touched them in their long history of being in the medical arena. So, you know, we have a lot of patients who've grown up in the medical arena. So they've had a lot of people influence their decisions. So I don't think it was just me.
Well, they think it's a lot of you. So we're going to talk a lot more about, we're going to brag on you a little bit more than that here today. But Dr. Surface, give us a little bit of background on the workflow of the clinic. What is Diane's role?
Sure. So, you know, the clinic, the Adult Congenital Heart Disease Clinic, is really the linchpin of our program. That's where we see all of our patients. We get echoes that Elena will get for us, and Diane and the nurses are really the lifeblood of the program. You know, they're usually the first face that a patient sees and the last face that a patient sees when they come in and out through the clinic. And Diane has been taken care of so many of our patients for so long that a lot of them, like you said in the video, probably look at you as a bit of a mother figure to some degree. And you know, you've watched them grow up from the time they come out of pediatric into adult care all the way through marriages and children and job changes and life changes and important medical changes, and you're there all the time. And Diane and our other nurses provide a lot of education at the end of a visit about what their congenital heart disease condition is, and provide resources, and also, so much more than that, there's a lot of work that goes on behind the scenes. So patients call in, patients have questions, you know, patients need surgery in a rural hospital in Kansas. Well, the first person who's fielding that phone call is Diane or one of the other nurses, and helping triage some of those issues. So there's a lot. It's a lot.
Well, of course, we've seen huge breakthroughs in science since Diane started working, just as you have said, you know, but just how do those years of experience benefit the clinic? Just knowing that you can lean on her for all of that experience.
I mean, you're so right that all of medicine, but the field of adult congenital heart disease in particular has really changed over the last few decades. And that's true nationwide, worldwide, but also here specifically at KU. And really our program in particular has undergone a lot of change and growth over the past just 5 years even. And so one of the biggest things that Diane's able to provide is a sense of stability and familiarity to so many patients who've been here for so long, and all of a sudden they're meeting new doctors and new nurses and new technicians and new procedures and new imaging studies, and there's a lot of new. And Diane is there to be a rock for them, and that can be a really big deal for patients who have been established for so long.
Elena, I see you shaking your head, agreeing.
So much so. Yes, I scan patients all the time, and I get to talk with them, and so much of the time, is Diane still here? Yes, she is. And they tell me all the time, she was great. She came in after the doctor and drew me pictures so I understood more and helped me through surgery. And then she was there when I had kids, and I just talk so highly of her. It's so nice to have her stability there for those patients.
Invaluable. Diane, the tech may be different now, but the core values of nursing are the same, as I would imagine, as they were 50 years ago. But what's it been like to see the new science and technology develop over the decades?
It's been amazing, because when I first started working in the ICU, we didn't have any of the stuff that they have now. Right. So to see that all come along, and then when I was working, the last place I worked, they started doing transplants there, heart transplants there. That was all new. And then just the surgical techniques, the catheter techniques that they have now that they didn't have, that has allowed people to grow up to adulthood and have good lives. And there's more adults with congenital heart disease now than kids. So I don't know how long it's been that way, JD, but
a while now, but the number keeps growing. The ratio keeps growing.
Well, I would imagine. And if you're like me, like I push back against technology when it comes to a lot of things, but when it's something that benefits patients and these people that you watch and knowing that they're living better lives, I can imagine that just being such an amazing thing to see.
Yeah.
Elena, how old were you when you first met Diane?
I was 28 or 29.
What do you remember about that time and that relationship when it first started building?
I was very thankful for Diane, because I had just moved to Kansas City and I needed to establish care here. And so there was only one cardiologist, congenital cardiologist here at the time, and so I went to him. But Diane was really there to be like, we've got you, we're going to take care of you. So I was very thankful for that.
Well, as she tried to be humble on her impact, as we heard, we'll let her be, but we're not going to let you be. But how did she play a role in your decision to become an important role yourself in healthcare?
So I already had my career before I met Diane, but she instills in me that I need to continue it. That, you know, she's been doing this for 50 some years, and how incredible that all these patients get to come back and say, Diane helped me through so much, and I want that too. Like JD was saying, she's a rock for so many of these patients, because we've had a lot of turnover and new doctors, but Diane's always there, so we can always count on Diane. And I want to be the same. I want to be able to have a familiar face that they can count on me.
Yeah, how important is it to have mentors like that in healthcare, again, that have been been around a minute. Hey, when you came in this morning, you said to me, you've been doing this a long time. So I guess we both can relate, right?
Yeah.
So I can say that, I guess.
Yeah.
But Dr. Surface, your opinion on that too, just the importance of having mentors that have been doing this a long time and have seen the changes, that have those solid core values, but have seen those changes over the years. How important is that?
Yeah, medicine, whatever field of medicine you're in is to some degree fundamentally an apprenticeship model, right? We all sort of learn from the people who have been doing it before us, and there's lessons that you can learn from that you can't learn from a textbook, that you can't learn from a YouTube video, because that's how med school is conducted now. I don't know if you knew that.
Good to know.
Not YouTube videos, at least not mostly. But that mentorship is critical because you can learn medical stuff, but you can also learn through example. How do you take care of a patient? How do you help a patient through a really tough time? And that's something that you can only learn by observing and learning from a pro like Diane.
Yeah. Well, we already have some great questions coming in. If you have any questions, you can send those in to YouTube, Facebook, or you can send them to the All Things Heart email. You can find those links right there on your screen. Elena, you are a congenital echosonographer. Tell us what that is. What does a day in the life look like for you?
So I use ultrasound. Mostly people think about babies when we hear ultrasound. I use ultrasound to look at the heart and help diagnose and follow heart problems. So we bring the patient back to a room where it gets really dark and lay them down on the bed and use the ultrasound probe to scan the heart and look at their different heart defects to see how they're doing and help JD and Diane to, does this patient need a valve replacement? Are they doing well? Is their heart function doing well? Kind of making sure that the patients are taken care of from my standpoint so that the doctors and nurses can help the patient get the care that they need.
Do you ever share with patients that you have experience with congenital heart disease?
A lot, yes. It's a lot of times patients are nervous and they're scared because they know that they are going to need a valve replacement. And so it's like, I have a heart defect too, and I'm happy to share with you my experiences. And sometimes it's just really nice to have someone to be able to communicate, I know what you're going through. I have it too. My normal is not a normal person's normal, and I get that.
What are those conversations like? Do you see kind of a physical reaction when they go, oh,
Mostly
really?
they're
Wow.
relieved. It's stress off their back for sure.
I would imagine. Dr. Surface, how does having staff with their own heart issues, like we just mentioned, how does that improve the clinic? I could imagine it does.
It's tremendous.
There's a vibe.
Yes, it's a huge, and patients really do appreciate that because one of the sort of unique things about congenital heart disease is there's this misperception in some of the medical community that congenital heart disease is a pediatric problem. But like Diane said, there's more adults living with congenital heart disease in the United States than there are children. In fact, it's a ratio of probably close to 3 to 1 at this time. So really, congenital heart disease is an adult problem. But so much of adult medicine does not know what to do with their congenital heart disease. And these patients go through a medical system where even the doctors that are following them don't understand their disease. And so having people like Elena or Brooke or others in our program who not only are trained not just in doing echoes, but in congenital echoes specifically, but also themselves have a history, know what it's like to go through this treatment, I think is a huge relief to these patients. They know, oh, I'm in a place where people understand me. And they go through so much of their time where they're not. And that can be a really scary situation.
Dr. Surface, it just speaks volumes on the environment that you've formed the Adult Congenital Heart Disease Clinic to now have patients wanting to work there. I mean, that just says a lot. But just reiterate how that experience helps these women do their job better.
I don't think anything that I have done allows them to do their job better. I think it's the other way around. I think we have a really tremendous team here, including Diane and Elena and so many others who have really worked to make this place a great place to work and a great team to be a part of. And I feel that every day. Put some pep in my step every day as I get up.
I bet they do. You're pretty peppy, though. I don't think you need a lot of pep. But
well, it's all Diane and Elena.
Diane, what do you hope to continue to instill in these young workers and colleagues of yours?
Well, I do think it helps, like Elena was saying, to have people familiar around for a while. And you don't see that as much in this day and age. But I do think it's important because there's no end to learning. You know, it's a area of cardiology that there's just still always something to learn.
Right. Yes.
To me, that is exciting, and it sucks you in. It keeps you there. So I would say that, you know, to stay and learn and get to know these patients, and they become friends, and they trust you. And I mean, we've been to birthday parties of patients that didn't think they'd make it to 30 or didn't think they'd make it to 40. And so to be a part of that is really so cool.
That's a big deal.
Yeah.
That's a real big deal.
Yeah.
Well, let's get to some questions from our viewers. And on that note, Derek wants to know, how long do you plan on working as a nurse?
I don't know. It's year to year.
I bet. Yeah, what do those conversations look like? I mean, you just kind of go, I'll let you know when I'm done?
Yeah. They ask me every summer, what do you think? Are you going to? And I just work PRN now, so just as needed, so I'm not there.
You're needed every day.
Okay. I know. I don't know. I don't know what that's going to be like when she's like, I'm out of here.
Yeah. Well,
You're not going to be very peppy. That happens. I can tell you that.
One of the great things about having Diane around every once in a while, more than every once in a while, but on a PRN basis, is our nurses who are sort of newer to the clinic get to benefit from Diane's mentorship and learn about the patients and about the disease states and about the process. And so Diane has not just done a tremendous job as a nurse, but is also helping train the next generation of adult congenital heart disease nurses here at KU, and that's really fun.
I have a comment from Allie. Thank you, Diane and JD, for your contributions to our community and farther. It takes special people to pour their heart and souls into caring for others. Bless you both.
Oh,
wow.
That's nice.
Well, thanks, Allie.
Well, there you go. Okay, Jeremy has a question for Diane. I imagine at this point you've seen it all. Mm-hmm. Have the parts that you love the most about being a cardiac nurse changed over time across your career?
Not really. No, I would say, you know, everything around it maybe has changed, but the actual core reason that you're there is, you know, to be a person that's there for that patient, who is there to care for that patient, to answer their questions, to get to know them. That really hasn't changed.
I really like this question from Stuart. As we know, nursing turnover can be high. We've seen that over the years. Why has Diane stayed in nursing when other nurses have not?
I've just always loved it. I just have always felt it was what I was supposed to be doing with my life. So I've just always, it's such a great field to be in, because there's always something to learn. There's always something changing. There's always people that are going to need your expertise. So, yeah.
Elena, same question to you. What makes you stay and be a part of the healthcare community?
Well, I have a heart defect, and so I want good care. And so I want to provide that to everybody else who comes in. So that's a big part of it. And plus, I can't get enough of Diane, JD. We're always working as a team, which is really special too. I can call Diane and say, hey, I have this patient, I'm worried about this. And she's like, okay, I'll pass that on to JD, I'll pass it on to Dr. Rockefeller, and that's really awesome that we can provide that care quickly.
Dr. Surface, Amy wants to know, how many different types of congenital heart defects are there?
How much time do we have?
You go for it.
The answer is a lot.
Okay.
And that's one of the fun things, like you said, about congenital heart disease. Every day you see something you've never seen before. You know, every day there's something that comes across, you know, my desk where it's like, wow, that's interesting, because, you know, it turns out when the heart works well and is formed normally, it's, you know, they all look very similar to one another, but it can go wrong in a very vast array of different ways in terms of how it's formed. And then there's also this very interesting history over the decades of, you know, the way that we treat a certain problem now, if a baby was born with it, is very different than the way that that problem was treated 20, 30, 40, 50 years ago. And so we have a lot of patients who are, you know, adults in their 40s and 50s and 60s who have the type of heart disease that will never be seen again because it was treated with a surgery that isn't done anymore. And so there's all sorts of different cohorts of patients across the decades that, and each one is just a little bit different. So I wish I could give you a better answer, but it's a lot.
Oh, don't worry, you'll be back on the show again. There's always time. A question for Elena. Can you expand on all the medical care that you have needed over the years due to your heart defects?
Sure. When I was first born, my mother did not get ultrasounds, so that was not a thing. I was born a while ago, and so they did not know I had a heart defect. So I was born, and I immediately went into the ICU, and I had surgery 6 hours after I was born, and then again at 16 months. And I was a failure to thrive baby because I just didn't have enough energy to be able to eat. So I had a tube placed to feed me. And then after the second surgery, where they opened up my pulmonic valve, and I did really well, and I just got more tired more easily, so I knew my body and when to stop. And as an adult, it's the same now. I just kind of know my limits and when to stop, but I'm doing really well and haven't had to have any surgery since then, and hopefully we're going to keep it that way.
Dr. Surface, what's it like hearing one of your colleagues share a story like that?
I mean, it's incredible. You know, every patient that comes through our doors is an inspiration in their own way. You know, so many of them have gone through so many ordeals from a very early age. And life and growing up has been different, you know, and it's just a testament to the resilience of Elena and so many of our patients to have not just survived through all that, but really thrived. And that's really our goal.
Thank you for sharing that story with us. Last question is from Becca. Has a question for Diane. What has been the hardest or most interesting change to adapt to in your 50
Probably
years?
Technology.
Anything specific that was like, oh, really? Do I have to do this?
You know, younger people grew up with computers.
Yeah.
We just had paper charts, and so when we first started using computers, I thought, I hope this is just a fad. So, you know, and things that are easy for them to catch on to. You know, it takes longer for us older folks. So,
For sure.
Yeah.
Well, as a reporter, we used to have to write all of our stories on a big legal pad. We'd write them on a legal pad and just read them. And then we had to put them into a computer. And I was the same thing. I was like, do I really have to do that? Can't other people do that? I'll just keep using a legal pad. I'll just write it all on a legal pad. And I'll just read it from here. So, yeah, I guess it's sticking around.
Yeah.
I guess this whole computer technology thing is apparently a thing.
Yes, it is.
All right. Fair enough. All right. Let's get some final thoughts. And Elena, let's start with you. What do you want people to know?
Oh man, what do I want people to know? That Diane is wonderful and that she's too humble for her own good. She's brought so much advice to me and other colleagues and support to the patients and other colleagues, and we're just not the same without you. Come back full time.
Not happening, is it?
No.
Okay. I think they'll take you half time. They'll take you half time. What do you want folks to know? What are some final thoughts from you?
Just that I'm glad Dr. Surface is carrying the torch from Dr. Mulhern, because when the program first started and we started working with Dr. Mulhern, we thought, are there going to be that many patients? And he said, if we build it, they will come. And so that's
proven to be true. Yeah.
Yeah, and just to keep learning and to keep that enthusiasm about your job.
Yeah, following your passion and staying with it for decades.
Yeah.
And passing it along, passing the torch. Dr. Surface, what are some final thoughts?
Mostly just gratitude for Diane and for all of her time in the clinic before I showed up, but also since. I mean, it's really been wonderful getting to learn from you and to see your experience and especially your relationships with some of our long-standing patients that just, they really love you.
Oh,
and they really appreciate all of the care that you provided over the many years. So thank you.
Yes,
Thank you all for being with us today. We appreciate it. What a fun conversation. If you would like to watch or share one of our previous episodes of All Things Heart, you can scan the QR code to find a list of all of our shows. Next week on All Things Heart, struggling to breathe, Jody Roberts thought she had asthma. She was uncomfortable for years before finding answers and a doctor that she trusted here at the health system. That's next Thursday at 8. Coming up tomorrow on the Morning Medical Update, one of the best things to come from the COVID pandemic was the expansion of telemedicine, but the rules are set to change. I'm Jessica Lovell on the next Morning Medical Update. The push to protect video visits, plus the benefits for patients who simply can't make it to a hospital. Friday at 8.